And today also the CDC is announcing additional steps Americans can take to defend against the transmission of the virus. From recent studies, we know that the transmission from individuals without symptoms is playing a more significant role in the spread of the virus than previously understood. So you don't seem to have symptoms and it still gets transferred. In light of these studies, the CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary. You don't have to do it. They suggest it for a period of time, but this is voluntary. I don't think I'm going to be doing it, but you have a lot of ways you can look at it as follows. The CDC is recommending that Americans wear a basic cloth or fabric mask. They can be either purchased online or simply made at home, probably material that you'd have at home. These face coverings can be easily washed or reused. I want to emphasize that the CDC is not recommending the use of medical grade or surgical grade masks, and we want that to be used for our great medical people that are working so hard and doing some job. Medical protective gear must be reserved for the frontline healthcare workers who are performing those vital services. The new mask guidelines also do not replace CDC's guidance on social distancing, including staying in your home when possible, standing at least 6 feet apart for a period of time. Again, we're going to all come back together here. We're going to all come back together and practicing hand hygiene, which we should do anyway. As we deploy the power of our military, we're also deploying the skill of our doctors, scientists, and medical research. I'm also signing a directive invoking the Defense Production Act to prohibit export of scarce health and medical supplies by unscrupulous actors and profiteers. The Secretary of Homeland Security will work with FEMA to prevent the export of N95 respirators, surgical masks, gloves, and other personal protective equipment. We need these items immediately for domestic use. We have to have them.
Of preparedness for pandemic. Now, that largely has been, as I said in those remarks, about pandemic flu preparedness.
What would people gain from wearing a mask, and why are you opposed to wearing one yourself?
Well, I just don't want to wear one myself. It's a recommendation. They recommend it. I'm feeling good. I just don't want to be doing, I don't know, somehow sitting in the Oval Office behind that beautiful Resolute desk, the great Resolute desk. I think wearing a face mask as I greet presidents, prime ministers, dictators, kings, queens, I don't know, somehow I don't see it for myself. I just maybe I'll change my mind, but this will pass, and hopefully it'll pass very quickly. Now, with that being said, if somebody wants to, I mean, most people can just make something out of a certain material, so it's very well designated. It's very simple to do. I won't be doing it personally. It's a recommendation, okay? Would you like to say something about that? And FEMA, what a job they're doing. As we deploy the power of our military, we're also deploying the skill